Hi, my name is Isai Valente, and I am a current third-year animal science transfer. And in this video, I will be discussing the pharmacological properties of pseudoephedrine from the television show Make It or Break It. On the last episode of Make It or Break It, the morning of the 2012 Olympic trials, a young female gymnast tested positive for the presence of the banned substance pseudoephedrine in her urine. A jealous teammate, days leading up to the trials, had been secretly giving this gymnast fruit smoothies mixed with pseudoephedrine every morning in hopes of securing a spot on the Olympic team. The gymnast was prohibited from competing at the Olympic trials. Pseudoephedrine is known to be used by athletes as a performance aid. In this presentation, the physiochemical properties, pharmacokinetics, and pharmacodynamics of pseudoephedrine will be discussed to support or oppose the effects pseudoephedrine can elicit on an elite-level athlete training for the Olympics. Pseudoephedrine naturally occurs in ephedra plants and has been used in traditional Eastern medicine since 1889. Pseudoephedrine is a sympathomimetic amine used for its nasal and sinus decongestant activity. It has the capability to improve airflow and relieve nasal blockage in viral upper respiratory tract infections. Pseudoephedrine has many physicochemical properties. For example, pseudoephedrine is a weak base with a pKa of 10.25. It has a molecular weight of 165.23 grams per mole. It is 6.6 plus or minus 0.4% bound to human serum albumin and has a lipid-water partition coefficient of 0.89, indicating pseudoephedrine to be more soluble in octanol than water due to its lipophilic character. It has a half-life of 6 hours at urinary pH of 5 and a half-life of 16 hours at urinary pH of 8. Lastly, it has a volume of distribution of 2.6 to 3.3 liters per kilogram, indicating that it is largely confined to plasma. Pseudoephedrine is primarily administered orally in tablet form. The average adult may take a 60 milligram tablet every 4 to 6 hours, a 120 milligram tablet every 12 hours, or 240 milligram tablet once daily. Pseudoephedrine is mainly absorbed in the gastrointestinal tract following oral administration. We will now discuss the pharmacokinetics and pharmacodynamics of pseudoephedrine. Once pseudoephedrine is ingested orally, it will pass through various organs in the body before it is metabolized. It will pass through the stomach, small intestine, veins of mesentery, portal vein, and then the liver. In the liver, pseudoephedrine will undergo first-pass metabolism, where it will begin to be metabolized. Pseudoephedrine is incompletely metabolized in the liver. Less than 1% will be N-demethylated to an inactive metabolite via phase 1 metabolism. The majority of pseudoephedrine is eliminated unmetabolized by the kidney in the urine. Typically, 55 to 75% of an oral dose is detected in the urine as unaltered pseudoephedrine. Pseudoephedrine acts as an agonist that mainly binds to alpha adrenergic receptors and beta adrenergic receptors in the mucosa of the respiratory tract and stimulates the sympathetic nervous system. The alpha adrenergic receptor is a GQ G protein coupled receptor that naturally binds to norepinephrine and epinephrine that are typically produced by the body. The binding of pseudoephedrine to the alpha adrenergic receptor activates the GQ alpha subunit and allows it to move and activate phospholipase C. The activated phospholipase C cleaves PIP2, causing an increase in IP3 and DAG. IP3 binds to its respective binding site on calcium ion channels of the endoplasmic reticulum and sarcoplasmic reticulum, increasing cytoplasmic calcium. The cytoplasmic calcium ions triggers the contraction of smooth muscle, causing vasoconstriction of the blood vessels, which aids as a decongestant. The sympathomimetic effects of pseudoephedrine promotes vasoconstriction of cutaneous blood vessels, vasodilation in the skeletal muscles, and a redistribution of blood from the skin and portions of the splanchnic bed to the skeletal muscles and brain. The oral LD50 of pseudoephedrine is 2,206 milligrams per kilogram in rats and 726 milligrams per kilogram in mice. Patients who experience pseudoephedrine overdose may show signs of giddiness, nausea, vomiting, sweating, and muscle weakness. 4 times the single therapeutic dose of about 240 milligrams is required to cause an increase in diastolic blood pressure above 90 millimeters of mercury in normotensive human subjects. Pseudoephedrine has been on the International Olympic Committee's list of banned substances for many years and is assumed to be because of how easily it is converted into methamphetamine and its ability to mimic the sympathetic nervous system. Findings from a randomized double-blind crossover study indicated that 22 healthy males ingested 180 milligrams of pseudoephedrine 45 minutes prior to exercising and showed greater torque in knee extension, higher heart rate following a 30-second cycle sprint, and the expiration of more air per breath in an anaerobic setting. There were no significant differences detected in strength endurance or upper body bench press tasks. An increased heart rate and vascular tone may increase cardiac output, which can send more supply to contracting muscles. Findings from a placebo-controlled study indicated no significant effect on the times of an 800-meter run for female college athletes. Pseudoephedrine can improve lung function and lower body strength and power. However, the small increase in performance is outweighed by the risks an individual is most likely to encounter when ingesting high dosages of pseudoephedrine. In the show, the total amount of pseudoephedrine consumed was not mentioned. However, the gymnast did consume pseudoephedrine for a couple of days, so the effects of the drug could have been sustained. Therefore, I strongly believe that the 16-year-old gymnast could have potentially enhanced her short-term maximal exercise performance, but would have most likely negatively experienced dizziness, headache, nervousness, and cardiovascular effects simultaneously. In conclusion, pseudoephedrine has stimulatory properties in the central nervous system, bronchodilation, and vasoconstrictive properties when taken in doses of 60 milligrams 3 to 4 times per day. Its similar chemical nature to amphetamines allows it to cause an increase in systolic and diastolic blood pressure, heart rate, peripheral vascular tone, and respiratory stimulation. The adverse side effects are greater than the enhancements. Therefore, this drug may be banned not for its benefits, but to discourage this type of drug doping. If you found this video interesting and want to learn more, I have provided the references down below and encourage you to take some time to read through them. Thank you for watching, and a big thank you to Professor Kucera and the TAs for a wonderful quarter.